Okay, what's the next important thing when we're helping these patients? They're safe, but are the pregnancy rates? A significant proportion of these patients now they're on tamoxifen. They have to be on tamoxifen for 5 years. So they can't get pregnant because tamoxifen has teratogenic effects during pregnancy. So they use gestational carriers. So you can see that out of 25, more than half, maybe close to 2/3, use gestational carriers. And pregnancy rates are 76.9%. Now, this would not be a real number in an IVF infertility setting, but remember, most of these women have no infertility problems. So they're like normal population. So their success rates are phenomenal. And recently, he came up with this concept of fertility preservation. This goes like this. Of those women, 24 attempted pregnancy with frozen eggs or embryos. 10 conceived once and 1 conceived twice, 2 pregnancy events. So out of 24, 11 were able to have children. So they have a fertility preservation rate of 46%. So all these women, about half of them, were able to build family as a result of these treatments. And the babies, we're following these babies, and I produced this picture with their permission, but I still put this to cover their eyes. And this is 3 babies from 3 embryos in 2 different locations. Letrozole babies. Going back to ovulation induction, how about safety of using letrozole during ovarian stimulation? My colleagues in Canada, they use a lot of letrozole induction. And they said, let's compare letrozole ovulation induction outcomes with clomiphene in terms of pediatric outcomes. There's similar rates of malformation, but interestingly, there's a higher incidence of cardiac malformations with clomiphene. And clomiphene is a very long half-life. It sticks around for 40 days or so. And letrozole is gone, it's a 48-hour half-life. It's gone in 3 to 5 days, no more than that. So that makes sense to me. But the drug seems to be extremely safe from the ovulation induction. My choice of ovulation induction a lot of times in ovulatory patients is actually letrozole over clomid.